Hi, everyone. I'm San Francisco Mayor London Breed, and I know that many of you have been anxious to hear what's happening with this new Omicron variant of the coronavirus. And we're here today to talk about and announce that here in the city and county of San Francisco, under the University of California, San Francisco, and our partnership with the Department of Public Health, using the latest of technology, we have discovered our first case, not only here in San Francisco, but the entire country. And I wanted to, at this time, introduce Dr. Grant Colfax to talk about the specifics and what that means in terms of what we need to do as a city. Dr. Colfax.
Thank you, Mayor Breed. Good morning, everybody, and thank you, Mayor Breed, for your ongoing leadership during this pandemic. And I want to thank our partners at UCSF, especially Dr. Charles Chu and his team, who worked so quickly to sequence this specimen. And I'd also like to thank our testing partner at Color, Dr. Scott Topper. Both are here today. And of course, my partner in our emergency response, Dr. Mary Ellen Carroll. All of us have been working furiously for the last 24 hours with our federal and state partners at CDC and at the State Department of Health to determine whether this is indeed the first case of Omicron that has been detected, and that has indeed been the result of our work overnight. I want to acknowledge our health officer, outstanding health officer, Dr. Susan Phillip, for her outstanding work. Her team worked really hard to ensure that we got this information as quickly as possible. But I also want to emphasize that this is not a surprise. For those of you who have been following this, we knew that Omicron was going to be here. We thought it was already here. We just haven't detected it yet. So this is cause for concern, but it is also certainly not a cause for us to panic. We are prepared here at the city for this. With regard to the case itself, the person recently traveled to South Africa and developed symptoms upon their return, and they did the right thing and got tested and reported their travel history. They had received a full dose of the Moderna vaccine, but no booster. They had mild symptoms and thankfully have now recovered. Contacts have and are being notified by the health department. And again, here's what we know now. San Francisco is relatively well positioned to respond to variants. Our vaccine rate is high. More boosters are going into arms every day. 5 to 11-year-olds are getting vaccinated at a rapid uptake. Our masking and vaccine requirements are among some of the most stringent in the country. These efforts have been very effective in helping us slow the spread of the virus. And there's still a lot we do not know about Omicron. We don't know how infectious it is, although there is a strong likelihood that it is more infectious than Delta. We don't know how sick it will make people, but that is being studied furiously right now across the world. And we don't know yet how effective, fully effective the vaccines are in protecting against transmission or serious cases of illness and hospitalizations due to Omicron. But most experts that I have spoken to believe that the vaccines will still be of critical importance in protecting ourselves, our families, and our community. So our message is the same as it was yesterday. To best protect against this variant, get vaccinated, for goodness sakes, if you have not been vaccinated. Get your booster if you're eligible. Continue to wear those masks inside where required. Continue to take the steps that we know that have been successful in San Francisco to prevent major loss of life and to slow the spread of this virus. We know how to do this in San Francisco. At this time, we do not anticipate changing any of our health orders or changing any current restrictions or imposing new restrictions on activity in San Francisco. We're obviously following these developments very closely. We will share additional information as we have it, And again, get vaccinated, get your booster, wear the mask, and for goodness sakes, it's been a long, almost 24 months now. Please have a great holiday season with your family. And now I'd like to turn it over to Dr. Chu, our great partner in sequencing the virus, and again, whose team worked so hard over the night to make sure that we got this information as quickly as possible. Thank you.
Good afternoon. My laboratory at University of California, San Francisco has been working very closely over the past year with the San Francisco Department of Public Health, the California Department of Public Health, and Color Genomics on genome surveillance of the virus. And by that, I mean that when we identify positive cases, COVID-19 cases in the city and county, we make an attempt to sequence all cases that we are able to identify. This particular sample was, I heard about it actually yesterday at about 3 p.m. and we were able to receive the sample in the laboratory by 8 p.m. We ran a very fast molecular test which looks for what we call spike gene dropout. What this test can tell you is it can tell you that you may have detected Omicron, but it's not conclusive. We were able to get the results of that test within 2 hours, showing that potentially this sample was an Omicron variant sample. But to confirm this finding, we needed to sequence the genome, the viral genome of this virus. And to do so, we used a pocket-sized sequencer called the nanopore sequencer. It's made by Oxford Nanopore Technologies. This is a sequencing technology in which we can go from detecting the virus to being able to assemble the entire genome within a few hours. So we were able to confirm the detection of Omicron within 5 hours, and we had most of the genome within 8 hours. 4 a.m. last night, we actually had assembled most of the genome. We were able to conclusively demonstrate that this was indeed an infection from the Omicron variant. Thank you.
Thank you. I think the overall message to the public is to get vaccinated because we know that we have a number of challenges that continue to persist with the COVID-19 virus, and what this means is we want to make sure that people get vaccinated. So at this time, if anyone has any questions, please let me know.
You have been served.
Any questions?
$200 million. www.diaryofafelon.com. Diaryofafelon.com. That's a $200 million lawsuit. Right there. For looking at my asshole following a 35-minute chokehold.
Are there any questions?
Right here?
Yes.
35-minute chokehold.
Wait.
And you're sitting.
Could you
35 minutes.
Dr. Colfax and Dr.
35-minute chokehold.
The percentage of cases that are being sequenced here in San Francisco versus in the rest of the state and the rest of the...
I'll let Dr. Colfax answer that question.
Think I'm not summons.
I'm sorry, I heard about sequencing, but I didn't quite hear the details of the question. I'll try to answer what I take the character of the question to be, which is we're continuing to work with Color, with Dr. Chu's lab, with the state to sequence samples. We work with a number of partners in doing that.
What percentage are you sequencing here? How do you choose and prioritize which samples get sequenced? And how does that compare to national and statewide averages?
So generally we're sampling more in San Francisco, and it depends on the site. So with our partnership at UCSF and the Latino Task Force at the 24th and Cap site, all those samples are being sequenced, and then I'll turn to Color to have them answer what percent of their samples are being sequenced. But I think the key thing is with the sequencing right now at the state level, the turnaround time is considerable. So that's why we really wanted to run this sample locally as quickly as possible. So as you know, across the nation and across the state and locally, we're continuing to ensure that we sequence specimens as quickly as possible. But again, I think the point is Omicron is here. We knew it was here. I don't want us to get, overly focused on when's the next case coming, when's the next case going to be detected. We should all be acting as hopefully we were yesterday, which is that Omicron is here. We need to get those vaccines and boosters. Get tested if you have symptoms or you know that you've been exposed, and continue to wear those masks. I don't know if Color has more to add, Dr. Popper.
Yeah, so Color Health provides most of the infrastructure that's used by the city of San Francisco and the state of California to execute their programs to defend against COVID. We work very closely with the COVID network as well as Dr. Chu's lab at UCSF to make residual samples available for sequencing. So almost 100% of the samples of the positive samples that are identified in San Francisco and in California are being routed for sequencing.
What's your name and title? Your name and title?
My name is Scott Topper. I'm Vice President of Clinical Operations at Color.
Can you walk us through the contact tracing, kind of how that works with this particular individual? It sounds like it's a really aggressive contact tracing versus unusual. What all has that involved?
Yeah, I'm going to let our health officer, Dr. Susan Phillip, answer that question. Dr. Phillip?
Thank you. And so I understood it was walking through the contact tracing. Is that right? For this particular individual. So I first want to point out that thank you very much to our lab partners, to Dr. Topper and Dr. Chu. We wouldn't have been able to do this without them. Also, very much thank you to the individual themselves. They recognized that they had recently traveled. They recognized that they had symptoms, and they did what we should all be doing, which is to go and get tested with symptoms. And then they reached out to SFDPH, to our team. We were able to speak with them. So with all investigations and contact tracing, we are talking to the individual, understanding, what their risk factors might have been, in this case, travel, and then speaking with them to make sure that they're staying home and isolated once they know that they have a positive test, which this person is doing, and then speaking to them about close contacts. So that is the usual path that we follow. That is what we're doing in this case, and we're in the process of doing that with this individual now.
What kind of close contacts did you
The question was what kind of close contacts?
have? Did they have people who were workplaces?
Yeah, for privacy reasons, we are giving out limited information about the specifics of the individual, but we are in the process of finding out the people that may have been in close contact with them and reaching out to those individuals specifically.
Can you define then how you classify a close contact in this particular case?
The general definition is of a close contact is someone who has been within 6 feet for 15 minutes or more. That is the definition that has not yet changed. As we are learning more, as Dr. Colfax said, about Omicron, we will understand whether that definition has to change if this virus is more transmissible. And so that is generally what we ask people about. We most often will ask about other people residing in the home, because as with other viruses, it's really the length of time and the closeness of being with someone. So that is all in process now.
So people who have traveled outside of the country, particularly to Southern Africa, be taking extra steps beyond what's recommended if they're asymptomatic?
The question now is people who have been traveling outside of the country, particularly in Southern Africa. Well, the travel policy and the reentry policy is governed at the national level. And so we know that there is a restriction on non-citizens traveling. We also understand from our CDC colleagues that additional steps and requirements will be coming into place. As of now, people are required to have a negative test within 70
and discuss briefly the news that was announced an hour or so ago. California, through a sequencing process at UCSF, has identified the first known case and has formally made public knowledge of that case as it relates to the Omicron variant. We know information has been presented already. We know that many of you are familiar broadly with that fact. I have no additional news to offer in terms of the specifics, except just to reinforce what Dr. Fauci and others have stated, and that is this individual who is a resident of San Francisco, was fully vaccinated, had recently been in South Africa, began their travels back into the United States on the 21st, landed on the 22nd, developed some symptoms a few days later around the 25th, got tested on the 28th. The test came back positive on the 29th. As soon as that test came back positive, that test through the testing company went to UCSF and was sequenced, and it was determined that this sequence was the variant that has obviously generated a lot of headlines. For some, a little bit of panic. The panic's gotten ahead of the information, but clearly is a variant that has generated appropriate amount of international attention as the World Health Organization and others have highlighted it. We will continue to work closely with our partners in the City and County of San Francisco, with our partners at UCSF. I'll remind people it's not surprising in many respects that California is announcing the first case. This state is the birthplace, after all, of biotech, of life sciences. UCSF, one of the leading genomic sequencing institutions in the world, and we are blessed to have their partnership and have their expertise, and we have, as you know, perhaps the most robust, not perhaps, we do indeed have the most robust testing program and protocols in the nation, and now with over 59.6 million doses of vaccine administered, we can certainly lay claim to having done more in terms of vaccinations than any other state in this country. As a consequence of those nation-leading efforts, not only are we here to highlight the recognition of this case, and by the way, it is correct, unsurprisingly, I'm just going to reinforce what was stated publicly.
Please welcome the President of the United States, accompanied by the Secretary of Health and Human Services and Gabriel Maldonado.
Great to see so many familiar faces and champions of this fight. Let me start by thanking President Biden and the members of the White House for hosting us today and for their steadfast leadership over the past year. I also want to thank our extraordinary team at the Department of Health and Human Services, Dr. Francis Collins, Dr. Michelle Walensky, Dr. Anthony Fauci, Admiral Rachel Levine, Surgeon General Vivek Murthy, Assistant Secretary Lois Pace, and so many other leaders who've helped the department improve the health and well-being of the American people. And finally, I want to recognize the generation of activists, the game changers, the people who made things happen, who have made their voice heard in this fight against HIV over the years. People like Pedro Zamora, an HIV educator and television star who died of AIDS-related complications back in 1994. Before his passing, Pedro asked the world a simple question. He said, "I wonder now, as I look around me, who's going to pick up my torch?" Today, we are still fighting to end the HIV epidemic, but we have not let Pedro's torch extinguish. Nor have we forgotten the 36 million people with Pedro who died from AIDS-related illness around the globe. As Secretary of Health and Human Services, I'm proud to lead a department and serve in an administration that is confronting the HIV epidemic head on. Look no further than the new National HIV/AIDS strategy that President Biden released today. Over the past few months, HHS has worked together with the White House and other agencies to develop a whole-of-society response to the HIV epidemic. This strategy provides a roadmap for ending the epidemic by advancing equity, expanding resources, and engaging those who have lived with this struggle, including gay, bisexual, and other men who have sex with men, racial and ethnic minorities, especially African Americans and Latinos, transgender women, and heterosexual women, people who use drugs, and people experiencing homelessness or unstable housing. Health and Human Services will play a critical role in implementing this strategy. And we're already leading the way through the Ending the HIV Epidemic in the U.S. initiative, EHE. Like the new HIV strategy, the EHE initiative is focused on ending this epidemic by 2030. EHE My team said to me, you better get an applause after that one. So, EHE will provide additional support to the 50 jurisdictions where more than half of the country's new HIV diagnoses occur, as well as 7 states with a disproportionate occurrence of HIV in rural areas. And I will be working closely with my Assistant Secretary for Health, Admiral Rachel Levine, and the Presidential Advisory Council on HIV/AIDS to support this new national strategy. Our HHS agencies will also continue to support the global fight to end HIV through the President's Emergency Plan for AIDS Relief, PEPFAR. We're working with countries around the world to train healthcare workers and improve detection, apply the latest research and safest medications, and provide life-saving treatment to those in need. We're partnering with the World Health Organization and others to advance critical policies that will save lives. And last month, the United States announced that we will host the Global Fund's 7th Replenishment Conference. Back in June, the Department of Health and Human Services marked the 40th anniversary of the first official report about AIDS in 1981. There are a lot of young people who don't even remember what that was like, but there are still people who do. We have come a long way in the last 4 decades, but as this year's World AIDS Day theme reminds us, we still have plenty of work to do to ensure equitable access to HIV services and to end this epidemic. And we need everyone's voice to make that happen. We all have a role to play, whether we are in government, healthcare, the private sector, or community-based organizations. It's on us. On World AIDS Day, we remember all those we've lost, the faces in the frames, the names on the quilts, the millions gone way too soon. Let's honor them the best way we know how, by picking up that torch and keeping it burning. Now, I'm pleased to welcome one of those in our community, a community partner, one of those game changers I spoke about, a fellow Californian, and it better get some applause. Gabriel Maldonado. As CEO of True Evolution, Gabe leads an organization that offers HIV prevention and care services. And we're thrilled that he, along with his incoming COO, who happens to be his mother, Marguerite, is here today and that they could join us with the president. Gabe is a true champion. Gabe is someone you're going to hear about for a long time. And Gabe is saving lives. And that's why he is here to get to introduce the President of the United States. Gabe, the floor is yours.
Good afternoon. Thank you to Secretary Becerra for your generous introductions and for making the people of California very proud with your leadership. My name is Gabriel Maldonado, an LGBTQ and HIV advocate and the CEO of True Evolution. a community health and social justice organization serving Riverside and San Bernardino communities in California. I am honored to be here with you today as we celebrate World AIDS Day, an opportunity to not only remember and honor the lives lost over the last 40 years, but to celebrate the lives living and thriving. The advocates, the healers, the freedom warriors who lead the work today. I founded True Evolution in 2007 when I was 18 years old to fight for health equity and racial justice to advance the quality of life and human dignity of LGBTQ people. At that time, platforms like this were scarce for people like me. It has certainly been a full circle moment to be here with you now, sharing a story that is not only my own, but represents millions of my brothers, sisters, siblings who are part of the many vulnerable communities. It is especially the opportunity of a lifetime to be here before you today because my mother is here with me. She was my co-founder and backbone as we built True Evolution. And when the day came to navigate my own diagnosis with HIV, I waded through months of loneliness and guilt. I held a belief that somehow this new circumstance of life would make me unlovable. But Mom said that this was all part of the mission, that life will give us experiences so that we may use them to find ourselves and our purpose. Her words would sustain me as I faced my own difficulties and disappointments when trying to access basic health services in my own community. Those experiences and her words inspired me to turn True Evolution into a direct service provider for the LGBTQ community, including those living with HIV and those at highest risk. Our mission was to create programs and services and deliver care to, for, and led by the people we wanted to serve, as well as a place to employ and develop them. What began in a kitchen counter in my first apartment is today an organization that provides comprehensive HIV care and prevention services, mental health, and emergency and permanent supportive housing. We celebrate our 14th year anniversary this month. It is all thanks to a team of 28 talented and committed individuals whom I have the profound privilege to work with. And later this month, we break ground on Project Legacy, a 1.25 acre community campus that will be home to 49 beds of permanent supportive housing, a primary care center, mental health clinic, open park space for wellness and fitness programs. And I think for so many of us who step into advocacy, we often begin in an effort to speak up for someone in our own home, a loved one, a friend, ourselves. And as a gay man, you discover along the journey the endless stories, experiences of struggle and challenge, of poverty, isolation, and injustice. And HIV has been and remains a very real part of the social and cultural experience for LGBTQ people in this country and around the world. Sitting at the center of many intersecting social issues, new rates of infection continue to be driven by factors such as poverty, lack of sexual health education, basic access to health care, homelessness, and cultural barriers and stigma. And there still remains so many people whom we've left within the margins. Indigenous and transgender communities, Black and Latin folks, our youth, women, and the millions of people around this country who live in rural and underdeveloped areas. The field of HIV has before it an opportunity to itself to meet the public health needs of tomorrow. The ending of the HIV epidemic is an opportunity to not just focus on the volume of clients and the number of patients served, but to the quality of life and human dignity that we leave them with. This builds on a rich legacy, as HIV response was first born out of community activism and has always recognized the intersections between HIV, human rights, and civil liberties. I am excited by the opportunity we have today under the leadership of President Biden, with the release of the National HIV/AIDS Strategy, which outlines our collective national work to end the HIV epidemic, the passage of the Infrastructure Investment and Jobs Act, and hopefully soon, the Build Back Better Act. We have a once-in-a-generation moment to make the necessary investments for communities that have often been ignored. Telehealth and mobile services, the creation of new healthcare facilities, and expanded access to public transportation and roadways for those who live in geographic isolation. This will all help us to end the epidemic. I am grateful, very, very grateful for this moment, to thank and send continued courage to President Biden and Vice President Harris in an era where political leadership requires renewed courage. And on that note, it is my high honor and privilege to introduce the 46th President of the United States, Joe Biden.
Mom, come on up here a minute. Come on. I want you to meet Gabe's mom, who I still believe is more like his sister than his mom. She is the inspiration. She is the reason why this young man has done such incredible things. And it's a simple lesson. My mother always told me, listen to your mom. Thank you. Thank you. You deserve a great deal of credit. Thank you. One other thing before I begin my formal remarks. I look out in the audience and I see so many people who've been in this battle for so long. But the one person who I know from personal experience, having been here for more than 40 years, who has been a champion when it was viewed as political suicide to be a champion, was the Speaker of the House of Representatives, Nancy Pelosi. Behind her as well, but Nancy, not a joke. You were the one who started that fight in a way that you took it on with such passion. And it was viewed as a political death sentence to take this issue on at the time. But you did it. You fundamentally changed the way we looked at this. You even got George Bush to lead on this too. No, but all kidding aside, I just want to personally, in front of all these people and all the world, thank you for your incredible work. Ladies and gentlemen, I'm also joined by the second gentleman. He is a hell of a lawyer. And I thank him for being here. And Mr. Secretary, thank you for your leadership of HHS. And I want to thank Gabe for sharing his story. Because, you committed your life to this work, Gabe. I don't know whether you had that plan when you began it, but it's amazing what you've done. It's amazing what one person can do. It's an honor to meet with you both and learn more about the work that you're doing together to support your community. Folks, we're also joined today by many who've been part of this effort for decades, including Dr. Fauci, who is, he's all things. You never walk away from an issue or a problem. Thank you. And all of you who contribute so much to this mission of advocating for better prevention services for those at risk of getting HIV and improved care services and living with HIV, breaking down the stigma and disinformation that still exists around HIV/AIDS. I want to thank you. Thank you for your voices, and for putting your hearts into your work. Because that's what you do. You put your hearts into work, and people can tell. It's because of all of you and the dedication of scientists and activists around the world that we've been able to dramatically reduce new HIV transmissions and make individuals with HIV today lead long and healthy lives. And you know, it's because of the persistence and resilience of the HIV community that we've changed so much about the way we approach healthcare research and equitable access to services, even relationship between patients and healthcare providers. You know, and it's because of you, and it's not hyperbole to suggest it, that we are within a striking distance of eliminating HIV transmission, within striking distance. And I think everybody but Nancy couldn't have imagined this, us being there 40 years ago. But the fact is that when CDC reported the first case that what we now know as AIDS, it's something that we couldn't fully imagine even 20 years ago, before the landmark investments that the United States made through PEPFAR and President's Emergency Plan for AIDS relief. But you made it possible. You made it possible, and I want to take this moment on this historic anniversary to acknowledge the incredible passion and the work that got us here. Because I know that so many of you, this is personal. Today, we once more raised a two-story tall red ribbon on North Portico, the White House, to remember how far we've come, the work we have left to finish, and so we never forget the price that's paid all along the way. And so many of you know and relations with people who have, whether they're family members or friends, and you've watched them in the past wither away. In the past 4 decades, as has been mentioned, an estimated 36 million people, 36 million people, including more than 700,000 here in the United States, have died of AIDS-related illnesses. Think about that. That many people, more than almost all the modern wars combined, all the wars combined. Here at home, we saw entire communities devastated by this disease, particularly among the LGBTQ plus individuals and members of racial and ethnic minority groups that you've already spoken to. And a generation that endured the brunt of this epidemic, losing friends, loved ones, family members, partners, instead of being seen and being recognized. And I can recall, if you excuse a point of personal privilege, being, I think, in this very room, when a senator who, he's deceased now, so I don't want to mention his name because he can't defend himself, but standing up and saying, along with another guy named Jerry Falwell, this is God's punishment, paraphrasing, God's punishment, finally. Think how much has changed. I mean, back in those days, the willingness of other members of the Senate and the House to stand up and take him on was, Nancy was there, many of you were there, but it wasn't a universal thing. It wasn't a universal thing. But you all demanded to be treated with dignity, with equity. Those voices, those stories are invaluable as we recommit ourselves to finishing the fight that we are going to make these individuals living with AIDS, and we're helping them drive and inform our efforts at every step of the way, because we're going to finish this fight. And so when my administration came to office, not only did we reestablish the White House Office of National AIDS Policy, which is hard to believe. I don't think that was the easiest possible thing to do. No, I really mean it. Think about it. Think about it. That it gets a round of applause in the year 2021 when we say that. I mean, it should have never, ever, well, I'm not going to get into that. But anyway. And I've asked Harold Phillips to lead our efforts. Harold. Harold, I think they know you. Harold is dedicated, he has decades of experience working with to end AIDS, the HIV epidemic, and I want to thank him for his leadership and willingness to join the administration and releasing the National HIV/AIDS Strategy for 2022 to 2025. That's what he's doing. It's a roadmap for how we're going to put our foot on the gas and accelerate our efforts to end the HIV epidemic in the United States by the year 2030. That's the goal. it centers on the kind of innovative community solutions, community-driven solutions that we know will work. It's a plan to make sure that the latest advances in HIV prevention, diagnosis, and treatment are available to everyone, regardless of their age, race, gender identity, sexual orientation, disability, or other factors. It shouldn't matter where you live in the country, or how much money you make, or how you respond, or how we have to respond across the board. The HIV epidemic everywhere, and support all people living with HIV. And critically, this strategy takes on racial and gender disparities in our health system that for much too long have affected HIV outcomes in our country, to ensure that our national response is a truly equitable response. So we're going to take aggressive action and back it up. We've asked Congress for $670 million, an historic budget request for the Ending the HIV Epidemic in the United States initiative. And I'm confident we're going to get that done. Right, team? We've got some great congressional champions for this work here today, starting with a woman, as I said, I've already mentioned, as she leader of the issue from the moment she set foot in Congress, starting with Nancy, but also Representative Barbara Lee. Maxine Waters. I learned a long time ago, Maxine says, I have an idea, just say yes. Just say yes. And Sean Patrick Maloney. David Cicilline, David, and Jennifer Gonzalez-Cullen. Thanks for all you're doing. I'm going to say not for your support. This is sui generis with all of you. You're just incredibly committed to this. And it's an issue that has a long history of bipartisan support, so looking forward to working across the aisle, God willing. I want to make sure that everyone in the United States knows their HIV status, that everyone with HIV receives high-quality care and treatment that they deserve, and that we end the harmful stigma around HIV and AIDS. In particular, there's still a large number of states that have HIV criminalization laws that do not reflect an accurate understanding of HIV. For example, HIV cannot be transmitted through saliva. There are still laws in the books that criminalize spitting by people with HIV. I mean, this is 2021, United States of America. But we have to follow science, and that means eliminating laws that perpetuate discrimination, exacerbate disparities, discourage HIV testing, and take us further away from our goal. We can do this. And as we accelerate our efforts at home, we're not going to let up on the efforts to fight HIV/AIDS globally. Leading reauthorization of PEPFAR in 2008 was among the highlights of my time as chairman of the Foreign Relations Committee. And at the time, by the way, I was not one of the great leaders in this. I always supported the effort, but it was because I was chairman of the committee. And believe it or not, there was a Republican president, and I'm not being a wise guy when I say this, who pushed for PEPFAR as an undeniable proof of the good that American leadership and innovation can achieve in the world when we commit to it. We have a moral obligation to do that and continue. Since President Bush launched PEPFAR in 2003, we've saved more than 21 million lives. We've prevented millions of HIV infections, and we've helped at least 20 countries bring their HIV epidemics under control or reach their UN AIDS 90-90-90 treatment targets. That means 90% of the people living with HIV in a country will know their HIV status. 90% of HIV-positive individuals are able to access treatment, and 90% of those receiving treatment for HIVs will have suppressed viral loads. That's within our power. We're doing that. And though through PEPFAR, the United States will support nearly 19 million men, women, and children with life-saving HIV treatment. It's an incredible, incredible achievement. Those are not the only lives saved. They're communities that are strengthened by the talents and contributions of HIV-positive individuals who are here today leading productive lives and leading the community because of what you've all done. And as we've faced COVID-19 pandemic, we've also reaped additional benefits from our decades-long investment in strengthening health systems around the world through PEPFAR. Working through the CDC and USAID, PEPFAR supports more than 70,000 case care facilities, 3,000 laboratories, nearly 300,000 healthcare workers across 55 countries, all of which have been vital in supporting the global fight against COVID-19. By strengthening countries' ability to fight AIDS, we've also improved our collective ability to fight other diseases. And I want to thank and recognize a guy that I can't believe all he's done, Dr. John Kingasong. I apologize. Doc Kingasong, stand up. Dr. Kingasong, you can call me Joe Biden. But you're helping lead the important work of Omicron variant in his current role as Director of African CDC, and who is my nominee for Ambassador at Large to oversee PEPFAR and our global efforts to combat HIV. I understand you're joined by Peter Sands. Peter, stand up, will you? Executive Director of the Global Fund. This year marks 20 years of the Global Fund, and the United States is proud to be both a founding member of the fund and the largest contributor, and the United States is looking forward to hosting the Global Fund's 7th Replenishment Conference next year here. And so, thank you. We still have a difficult road ahead of us. We can't kid ourselves, particularly addressing the disparities we see both domestically and globally, including the impact of high transmission rates among adolescent girls and young women. And today, as we look back in the past 40 years, where there's been so much pain and suffering, it's a testament to all the hard work represented in this room and around the world, that we're gathered today with hope in our hearts and for the future that's within our grasp. We can do this. We can do this. We can eliminate HIV transmission. We can get the epidemic under control here in the United States and in countries around the world. We have the scientific understanding, we have the treatments, and we have the tools we need. We're going to engage with people with lived experience with HIV and ensure that our efforts are appropriate and effective and centered around the needs of the HIV community, not us, centered around the needs of the community. And folks, together, we're going to save lives. I can imagine no higher calling to which we could be dedicated than our commitment to save lives. And this is the one area where we can get a lot more done quickly. So I want to thank you all again. I'm honored to be with you today. And this is one heck of a group of people who have hearts that are as big as their heads. And thank God, have in those beautiful skulls so much knowledge and capacity. So thank you, thank you, thank you.
school personnel and parents.
About the same issue?
About a different issue.
What was that issue? Did they?
I really can't go into the specific issues on either day, but two different meetings happened.
Can you give us any insight into his mental state? There was, obviously he's on suicide watch. If he's moved to a county jail, will that be continued? Are there concerns about that?
Well, typically anytime you have somebody with the active participating role in a tragedy such as this, they're put on suicide watch just to ensure that nothing happens. So that's kind of SOP, standard operating procedure, and absolutely if he gets transferred to the Oakland County Jail, that will happen.
There have been a number of copycat threats throughout the county today.
Sadly.
Deputies are already beyond busy, but I assume that has already taxed your resources.
Yeah, spot on, Russ. Yeah, there's it's some weird anomaly. Every time something like this happens in the country, there's a whole bunch of copycat threats and texts and pictures, and it really burdens law enforcement all across the nation. We're actually in schools today investigating what we think are part of that incredibly disturbing trend. And that's again, it raises the level of anxiety of parents, students, and teachers in schools that had nothing to do with this individual incident, but are now feeling very much anxious and tied to it. And that's how it broadens this whole anxiety and depression that many parents and students are feeling. And it's incredibly disturbing. And so when those kids or whoever we find out call in or do these text false threats, as you've seen us in the past, we attempt to get charges on them. Even if it's not a credible threat, the mere threat is a crime. And if you make a threat, we're going to seek charges.
Again, apologies on the redundancy. No evidence of bullying from where you sit right now, correct?
I specifically myself asked the school district. They had no information in any of their records that he had been bullied, and we have had no information brought to our attention from any other source that he had been bullied.
Thank you.
Sheriff, the prosecutor said that the suspect may have been planning the shooting for a while. Do you know if the FBI was aware of any of this prior to?
At this point, I'm not aware any law enforcement agency had him or the school on their radar for this particular incident at all.
For this particular incident, what about previous incidents? Or
any incident involving him. Okay. He wasn't on any law enforcement radar that I'm aware of. Certainly not ours. We had no communication about him or about anything that was pending, and I haven't heard from any law enforcement agency that they did.
Was the suspect a gamer? Did he have any video games?
Apparently, he was interested in games. I can't really comment on what those were at this point. That obviously is something that will be looked at as well.
Sheriff, is the belief that he took the gun illegally or was given the gun illegally?
That part of the investigation. In any event, he had the gun illegally, took the gun illegally into a school, and used the gun in an illegal and murderous fashion. So we've got a whole bunch of charges already, regardless of how he came into possession of it.
Any clarity you can give on his familiarity with weapons, perhaps gun range use, etc., in terms of his background and familiarity with guns?
I don't know much beyond what we saw in evidence in the school, and that will be part of the investigation, obviously. With this particular weapon, it's our understanding it was purchased 4 days ago, so this particular weapon, probably not a huge amount of familiarity with.
But over the years, other weapons?
That's part of the investigation.
What's your perspective on the terrorism charge, the impact of that message it sends to the community?
I agree 100%. If you weren't hit by a bullet, doesn't mean you weren't terrorized that day and won't have nightmares about it the rest of your life. Whether you're a parent, a teacher, or a student in that class. Going through that building in the wee hours of this morning and looking at the disarray in the classrooms and the backpacks strewn across the floor, that had to have been an absolutely terrorizing moment in anyone's life. I don't care if you're an adult or a child.
How much more time do you expect on processing at the school itself? Are you pretty much done?
We're pretty much wrapped up with the physical processing in the school, not necessarily the evidence that we obtained from it.
There's a search warrant executed at the parents' house. Are there additional properties that you're looking at that require similar searches?
We did seize some property at the house, and our detectives are going through it. So I think I mentioned this before. We've got a lot of different bundles here that we're fortunate to have under our own roof. We have our own crime lab, so they're processing things as it relates to the scene and items that were seized there. We have computer crimes looking at any kind of digital evidence, including his phone. We have detectives looking at any potential documents or other things that may contain information or things relative to, some of his thoughts. Maybe it might be contained in some of that. So a lot of those things are kind of spanned out to all of our different specialists, and then they'll be brought together under the officer in charge of the case and relayed to the prosecutor.
Can you give us any details on what was seized, or maybe the volume of material that was seized?
I can't get into the details of what was seized. I can just tell you we have a voluminous amount of stuff and things to do. Stuff to go through and things to do.
Sheriff, I just have one more question, and I believe you answered it previously, so I apologize for that. Will your investigators, will they have a follow-up conversation with the school in regards to why you guys were not informed about that meeting or his behavior?
Certainly our investigators will be and are in close contact with that school, and we're in close contact with all schools in Oakland County, and we encourage all schools, public or private, houses of worship, businesses, anyone that has any concerning behavior, they should report it. Allow law enforcement the opportunity to make the situation safe, to say there's nothing to it or we need to look deeper. That's what we want to do. It's not a burden, so we encourage people wherever they are, if they're concerned about something, let us know, or let your local police know.
The term concerning behavior, does that constitute threats in specific?
I don't want to get too awfully into what was concerning, because then I get into the actual content. But, it's one of those things, if someone looks at it and you go, oh, that doesn't seem right, whether it's threatening or disturbing, or maybe they're worried about someone being bullied or suicidal. We have obviously a huge problem in America with suicide, especially teens. If they see something that may cross into any of those realms, it needs to be shared so we can figure it out, A, if it's a threat to anyone else or themselves, and B, where to get help.
Has the school indicated why they didn't share the concerning behavior with your office?
That's all part of our discussion with them.
Sheriff, did he know about the meeting with the school officials and his parents that morning?
Did who know?
The defendant, I'm sorry. Did Crumley, Ethan, did he know that he was going to be meeting with school officials and his parents?
No, he was brought into the meeting and his parents were called.
Okay, so I'm asking because did he ever leave the school after that meeting?
No,
the
not.
gun was already in school. So the gun was somewhere.
Still, again, it's still a moving. We believe it was. I can't definitively say 100% that it was, but we believe it was because we've begun the process of tracking his movements and saw at what point and where he came out with the weapon.
Thank you.
Sheriff, do you think that some type of red flag law could have helped prevent this crime at all? Or I don't even know if something like that even exists for a minor. Could guns have been taken away from the parents' home? Or
I don't necessarily think so. I think the most important thing is to share information because, for anything, whether what you're talking about or a different process, you have to share. You have to say, this seems concerning. Can you look into it? And with or without that, we would. And say, hey, what's going on? What are you seeing? What are you hearing? What have you seen? And try to determine where it's coming from and where it might lead.
You may have mentioned this, but for the private security you previously mentioned, were they affiliated with the school or?
Yes.
After the meeting in the morning with the school and the parents, did the suspect go back to class? Was he released back to?
He was released back into the school from the meeting.
Do you have any video of where he retrieved the weapon from, like a locker or somewhere?
Again, the first time we saw the weapon actually in evidence was when he came out of the bathroom. So, you know, every other moment in time, it wasn't observed. So whether it was concealed on his person or in a backpack or hidden somewhere in the restroom, that is all part of the investigation if we can determine.
There's been some discussion of metal detectors in schools and whether that would have prevented him from being able to smuggle a weapon inside the building.
Yeah.
What are your thoughts on that?
The vast majority of schools in America do not have weapons or metal detectors. And you know, that's a determination for each district about what kind of environment they want to be operating in. But I know for a fact one of the last debriefs I got on a school shooter, he came in through a back door. You know, somebody was going out and he came in, walked in with a firearm and began shooting. So, you know, there's tragically nothing foolproof in a world where you have people that want to hurt other people. But again, the best preventive path that we've seen that has worked is to make sure everyone talks about something they've seen, heard, or witnessed so it can get looked into, to put training and protocols in place. In fact, that situation that I just mentioned where somebody came in a door that was a non-traditional door, they had radios as a school system all around the building, and anyone in the school was empowered to put the school into lockdown. And so a groundskeeper or a janitor, I can't remember his actual position, saw the person with the firearm going in the school and called it out on the radio. The school went into lockdown. They still had, I believe, 1 or 2 students killed, but everybody else was in lockdown, and the police were able to get there before any more perished. So processes, training, communication, that's some of the best paths that we've seen in terms of success.
Sheriff, will you be releasing any video footage from inside the school?
No, at this point that would become a handoff to the prosecutor for evidence.
The 14-year-old with a gunshot wound to the jaw and hand has been discharged.
Recent update, the 14-year-old with the gunshot wound to the hand and jaw has been discharged.
Any update on the young girl described yesterday on a ventilator after a chest wound and surgery?
I think she's still...
She's off the ventilator now.
She's off the ventilator, but she's still critical.
Yeah.
Yeah.
Thank you.
Yeah.
Did you mention a time for the arraignment?
It's probably happening almost as we speak. It's going to be a video arraignment. So the detective's driving in person to the district court where he's going to swear to the warrant. Then they're going to connect via video and arraign the suspect to that court.
Just so we're straight, can you relay the names of the folks that are still hospitalized in critical condition?
No, we're not naming the victims that are hospitalized. I mean, even the ones that are deceased, were sad to hear that they've been negatively impacted. You know, we had hoped that it would be uplifting and supportive rather than focusing attention that they don't want.
At any point in the video, did anybody try to disarm him, or were people just running from him?
Nothing I saw tells me that, and I'm not sure that we have any information on that front that has come to me. So the part I saw, there was no attempt. But obviously, when you've got somebody very close firing a weapon, that's not almost anybody's natural response to go towards it other than police and military. And that's with extensive training. Anybody else? Thank you.
Thank you, sir. Thank you.